Cool. Okay, so we're here to talk about a product called CaringBoost, which is a St. Louis company here in town. Been marketing this and building this past year. You can define it as clear, vital help for family caregivers. And today, obviously, something more along the lines of, 1 second, it's going a little slow moving forward on slides. Sorry, there's a little freeze there. There we go. Clear, vital help before and after the COVID crisis itself. This is a meme that many people have seen. You might be a caregiver if you've spent hours and hours online learning about health issues, and it's funny. We laugh, but it's no joke, because when you talk to these family caregivers, over half say they're overwhelmed trying to deliver the care that they're expected to deliver. It's called, and has been called for quite a while, the silent crisis. And what that kind of means is 1 in 7 US adults, that's 44 million people, they care for a loved one themselves at home, often at a pretty big toll for all involved. You're talking about, even if it's just basic care I'm doing, that's an average of 80 minutes a day that I'm spending. If it's anything beyond basic, it's 84 hours a week that these family members are using caring for someone. It hurts their work. 2 in 3 report that it compromises their ability to actually do their job. 1 in 3 actually have to change their job, including leaving it, based on the nature of what they have to do. If they look for help is kind of hard to find or hard to afford. On average, if I were to go like a caregiving service, that's about $125 a day, national average, just to have someone come in and help me on basic stuff. The majority of families, 2 in 3, they can't afford to do that. And the problem is exacerbated because even hospitals will tell you there's a lot of inadequate care at discharge in terms of the instructions. There's not a lot of actual expert training out there that's designed for non-experts. And what's out there, it's kind of scattered, and it typically is rarely very comprehensive. I mean, the Family Caregiver Alliance, one of the big advocacy groups, they say they need this information, they need the support for the critical role, but frequently they just don't know where to turn for help. And now the new layer, they often have described that they feel like they're on an island. That's a common statement. But if that's the case, then COVID-19, it's a tsunami that hit that island. So that silent crisis isn't so silent now. In fact, it's kind of screaming out. Forbes just this month, it's a terrifying time to be caring for an aging parent or a family member at home. It can be this all-consuming task. Because with COVID-19, obviously the home health and the respite services, they're reduced, they're canceled. Adult daycare, they're closed, or nursing homes locked down. And that's just more stress. That's more responsibility on topics that candidly, they're usually not going to be an expert on, and more fear than ever before. What they need is support now in ways that they can actually use kind of immediately among all the different things they have to do, which is why we're here today talking about CaringBoost. Now, what it is it's an online lesson library designed to be very easy to follow. We selected dozens of topics. Each lesson is evidence-based vetted guidance. It's actually been used to help some families with the Exciting Cancer Center who face a cancer diagnosis for over 2 years now. There's over 100 professional video lessons built into the CaringBoost and other guidance in a lot of forms. Now, this is a secure SaaS. It's a web app, so there's no downloads, no updates required by a user. It's for desktop as well as phone and tablet. We're actually in the middle of a soft launch. We started at the end of last year, moving this out to consumers and businesses. And the way we built the platform is it's designed to add new topics when new needs come about, or to do partner versions as other people want to take this gallery and integrate it with their existing outreach efforts. When we chose the topics, we kind of decided to focus in the areas that matter most to the family caregiver, the everyday care before and after surgery, meds, nutrition, all that stuff. In fact, we identified the whole caregiver journey. And in each step, we identified these things, including really the common everyday things that seem simple, but there's a right and a wrong way to do it. Something as simple as falls can have a massive impact on someone's life, all the way into the more detailed kind of medical requirements, like about caring for sutures after surgery, inhalers, nebulizers. Again, 31 total topics actually already covered. And when we do this, every lesson is designed, it's for everyone. These are jargon-free lessons. They're designed to make complex stuff very easy, very approachable. Again, there's 100 videos. Every lesson has videos, plus step-by-step explanations, illustrations when illustrations will do good, tables, infographics to explain topics, And then every lesson has these downloadable guides and instructions that they, in addition to just visiting CaringBoost, they can download it and work with it. So a lesson is broken up so that it'll never overwhelm somebody. So every lesson is treated this way. This is like an entryway for a lesson. It's what you need to know, what you need to specifically do, things you should tell your doctor, how to do things safely, common questions that like a nurse would tell you if you're actually able to be with them present. And of course, great resources that can help you on that journey as well. Susie Morrell, who was actually the last year's National Family Caregiver of the Year, she's familiar with CaringBoost. She was one of our testers, trying to say, hey, how to make this as good as it can be. She saw it as a very powerful source to educate families. She loved the quality, consistency, the simplicity of the way we just made this plain language so that it's there in the middle of the night. It's there when I need it. Just very kind and walking through. And then, of course, the nature of the way we built the content, it's perfect to parse out in separate ways for like free downloads we can give to people, or influencer marketing campaigns, or public service efforts. We actually took the safety at home lesson, turned it into this free handbook with a home safety checklist, room by room, all that great stuff. Or campaigns on helping about pain control, which is such a huge issue with caregiving, or infection prevention, which we all know is so key. So that's kind of it. I mean, that's what we are. So, obviously, if you ask why us, it's like, well, we're proven. It's expert content. It's available now in seconds for anybody. It can adapt at the speed. It's a platform that's not, it's not static. It's designed to adapt and move. Our biggest challenge as a company is awareness. Now, just from a business standpoint, we sell this two different ways. One is B2C, where we can sell it as a monthly subscription cost, or an annual, or like a family pack where you get multiple boosts that everyone can access their own. That was the plan during our soft launch, but because of COVID, we've actually paused that. And so we announced it got some news coverage on Fox 2. There was an on-air segment this past week where we basically said, we're going to take the CaringBoost product and it's available to everybody free right now throughout the summer. So basically anyone who wants to go can go there and get CaringBoost themselves. I suggest you do it for yourself or someone you know. Again, 1 in 7 people are in it. And very often you don't even know your close friends who are facing this. From a B2B standpoint, when we look at this, we can go to corporate HR for its employee assistance. Again, there's like $33 billion in measured lost productivity because of family caregiving in America any given year. That's pre-COVID. So corporate HR to employees for insurance companies, or any group or organization like churches, community centers that want to help their populations, even training for home health resources that have high turnover of people who come in who do that basic stuff. And obviously we look at resellers who want to come in and basically have that ability to posit this to people and then do a revenue share with us. So our needs, I'm wrapping up here. Our needs are a few. One is, again, our issue is awareness. So we're looking for like channel partners who have existing access to existing family caregiver audiences. Big reach, like, we've tied in with like some blogs, like Happy Healthy Caregiver. We need to do a lot more of that. Also, any sponsors and donors who want to fund CaringBoost post-summer, because again, we're making it free for everybody now, because it can do some real human good immediately. For deeply discounted subscriptions to needy populations. This is a perfect adjunct to telehealth, meaning once the conversation on telehealth is ended, who says the conversation has to stop? This is a great thing to assign to a family afterwards, so they have this simple, clear expert guidance. And of course, investors. In this case, I mean, the product exists in its phase 1 standpoint. We're looking to find ways to get funding to expand the marketing and sales, the industry outreach, and then phase 2 content, serving the journey even more and adding that in there. So that's kind of it. I mentioned that we're offering this free trial subscription. Anyone, and I suggest you do it, please, go to get.caringboost.com and you just enter an email address. We've actually dropped the credit card requirement of all of it. It's as simple as pop. And then you just get an email link and it's yours. And again, if anyone wants to reach out, we actually set up a little email address, hello@caringboost.com, if they want to continue the conversation after this discussion. So I'm going to take a breath and shut up and listen.
Okay. Thank you very much.
Thank you.
BJ, can you unmute people so we can all start asking questions? I'll just start and say,
side, you'll see home, you'll click on that, and you will be on this home
Yeah, you, whoever that was speaking, we could barely hear you.
That is. Yeah. I have a
Well,
question.
I'll start and I'll say, Jeff, a great presentation, and I know that is with a mother who's kind of taking care of a father with Parkinson's. I know exactly what you're talking. Everything you're saying is 100% accurate. So I think it's a great idea, and so so I'm not even gonna ask a question. I'm just gonna say, really great presentation, and I really think it's something that's necessary. So I'll let other people start with the questioning.
Thank you, Jim.
Do you need connection with home health care agencies?
No, this is designed for anybody, anytime. The lessons are based on, good hardcore evidence-based training that is given to nurses, then turned into more layman's language. So no, this is not something that requires the hurdle of being connected to anything. People can literally go online and buy it. We do social programs with Facebook, Instagram.
I was thinking more in terms of people who use home care agencies, probably other family members that could use your app when the aide is not there. So they might be a good marketing tool for you.
Mm-hmm. Thank you, man.
So I have a quick question. I apologize. My chicken went nuclear, so I missed like the first half of your talk. Who's your target
That's
market?
the first in 1 million cups history.
Yeah, I had to sprint off because it was like boiling over. And
Nuclear chicken effect. Okay, go.
It smells great, but yeah, never mind. Who is your target market? I missed that. Is it B2B?
It's family caregivers.
Okay.
1 in 7 U.S. adults are family caregivers. There's 44 million. That's our primary target, either through direct to consumer or through organizations that want to help these populations, like Alzheimer's Association, insurance companies, churches, healthcare providers who need the accountable care. That's part of making the viable healthcare model financially viable, is the populations have to learn more to be healthier.
Okay, so like family practitioners, like hospital level, a clinic level, or just no? Literally,
like Joe said. Joe, caring for someone with Parkinson's. It's just regular people who are facing this, and they're spending, one of the early slides was they're spending, even the basic caregivers are spending over 80 minutes.
Kind of the average person who does not have a medical training or background, they tend to get thrown into this either as someone's been discharged from the hospital after a surgery, or it's maybe over a continuous care scenario where they start to kind of get worse over the years with aging, and so there's really not much training available for them. They might have someone, if they have a home health person, kind of show them the ropes quickly, but they don't necessarily get a lot of material on how to do that on an ongoing basis. So they do a lot of emotional support groups, so they have to go to lean on, but it's not necessarily for the medical training. That was kind of the gap this was looking to fill.
Okay, so essentially you are selling your subscriptions to individual people? That's I'm still a little confused on. Or are you selling it to a channel and then they're distributing it out?
It's available both ways. So
okay.
We have like insurance, like coverage, they're interested. We want to buy deeply discounted CaringBoost subscriptions to give to everybody. Or like a self-insured corporation, a large corporation could basically say, hey, here's something we're making available to you. So there can be bulk sales, volume sales, but also we want to make sure anybody who needs this might bump into it and buy it themselves or for their family.
Do you have like follow-on kind of stuff? Because like, in other words, how do you separate yourself from like Mayo Clinic online or any of the other medical health sites that people cite all the time?
Well, most of the medical health sites and all that stuff, they're libraries of stuff, right? In terms of like explaining stuff. And for regular people who are kind of stressed and not necessarily, they're deeply needy, but not necessarily deeply engaged on topics, it's difficult for them to navigate. This is designed, it was actually originally thought of by a nurse who said, wow, this just overcomplicates everything. It shuts people down, just regular people. This is, if we were to put us versus like any kind of vast gallery of training, you don't have to look for anything here. Literally what you need is right then when you need it in a simple flow. So people can just go right through the lesson, get to the point, get what they need, and then move on. And then it's video, illustrations, downloadable guides, whatever, people learn different ways, right? So this is something, so whatever kind of person you are, a lesson can help you one way or the other, if that makes sense.
Do you have physicians and nurses on your board or your advisory board?
Yes, we do. This was originated obviously from the healthcare industry. We are not healthcare professionals ourselves, but the information's vetted, constantly by medical professionals. And then whenever we want to add new information, it would be coming from credentialed professionals who want to say, hey, I want to add this section. We're talking with people about adding like emotional health support, stuff like that. So that's one of our needs, is if people want to get involved and boost their information, we're all ears in terms of something to add to the gallery.
It sounds like you ought to do a strategic alliance with AARP or with Kaiser Health, and they pay you big bucks to license your stuff, and then they just provide it as value added to their members.
That would be a wonderful outcome. Yeah.
Particularly the fact that it's layman's terms rather than medical language. I would think if you got some endorsements from like the Nursing Association or the Home Healthcare Workers Group, or, if you can get some endorsements that you can take with you when you go to approach Kaiser or AARP, this is the sort of thing that, it's one of those things that's really going to be very helpful and nice value added.
Thank you, Mary.
Can I ask how you're planning on selling this? I mean, you've kind of touched a little bit on your marketing, and obviously right now you're ready to go.
Yeah.
You kind of talk about your marketing plan?
Sure. So there are a variety of avenues. We've done obviously social-based platform outreach with, downloads, free downloads, some influencer with like the Happy Healthy Caregiver blog, who's a well-known influencer who talks about the product to her following. We want more of that, certainly. We also have a sales team that is reaching out to, those particular organizations on that list, where we're approaching large and medium-sized home health agencies and companies like insurance companies, managed care companies, with this proposition to do a more of an enterprise level contract. That's the goal. We're also, this is a perfect product to serve a lot of government grants to help disadvantaged populations. So we actually have some professionals on that topic, specifically identifying some large grants, either state or federal level, that this might be a good slot in to help that immediately.
Right.
Yeah, you could probably even get SBIR money. I don't know if you've thought about that avenue, but that's another, as far as patient care, especially in this time and age, that might be another avenue to pursue. I mean, that money takes a while, but it's all free money,
Right. It's a great idea. Love that. Thank you, Chris.
Have you trialed this somewhere? Like, I saw your website.
Yeah.
You're local.
Sure. Well, we are St. Louis. Our office on the Loop.
Mm-hmm.
We actually have the full company's Total Orbit, which creates something called CareOrbit, which is a more robust journey virtual mentor product versus a gallery, which is CaringBoost along those lines. We actually integrated the entire CaringBoost gallery into some of the Orbit product in the Sightman Cancer Center. So families facing like pancreatic diagnoses for the last few years actually had access to some of these lessons that are relevant to them. And they're well loved. I mean, they're well visited pages along those lines. Yeah, so people tend to respond well the way the information's parsed and shared, with the way the lessons are treated.
So if you're plugged into Sightman, something you might want to consider is writing an academic paper or two showing how your program benefits patient outcomes. If you especially have some sort of proprietary way of laying out the information in a clear manner. Publications are just like another way of free advertising, and they just give you credibility too. So just something to consider, especially if you're already plugged into Sightman.
Come on, people. Let's do better than this.
I've had 4. Come on.
Yeah, I know. Chris
Good. Hey, man, this
accepted.
guy had me
I've
a chicken, and he came up with 4. I mean, I think that's pretty.
No, this is
awesome.
interesting. I'm an MD. I'm an MD PhD. So I mean, medical research is my
awesome.
bag. So it's I mean, this is always anything that can smooth the transition, because especially just caring for themselves, sleeping, eating is pretty much all they have time for right now. So anything that can just facilitate the transfer of information that's been vetted, I'm all for it.
Mm-hmm.
I do have.
Yeah,
This is
it's great. I mean, it seems like.
Go on.
Go ahead.
Well, I was going to say.
I was going to say. I mean, sometimes.
I was going to say this is a dumb question, but it's actually relevant to my mother. I know would print up everything, and is everything printable? Is all the information printable?
Yeah.
I mean, it's
every lesson has buttons that literally say downloadable guides, specifically for the people who need that information.
Good.
Yeah, totally.
Because I'm sure she's not the only person. I mean, a lot of people.
Oh, yeah.
Heck, I like downloading and printing stuff still. So I mean, okay, it's a little technical question, but.
Well, it's one of the things, like when you build an engagement product, I think a lot of people build it as a roller coaster. There's only one way to kind of get it, like the quote unquote perfect way. I think the secret to great engagement products is more like a theme park. People can come in and do different ways to kind of take advantage of it. Then everybody, you know, the millennial can love it, the grandmother can love it, and everyone in between can all take something from it in the way that they consume information best. So I was saying to Chris's point was, often some of the topics covered in here would be considered kind of soft topics, right? Because you know, it's really simple stuff. It's this, it's that. It's not medical, you know what I mean? But I think increasingly, you know, as COVID becomes like the great clarifier, I think that people are starting to realize that kind of better communication is better medicine. You know what I mean? It's like you're talking about serious, based on a simple way of explaining something better. You know, someone would want the best scalpel, but they don't always, you know, see the value of a better way to engage and have somebody understand something in a really nuanced human way. I think they are going to learn that, you know, and hit that, but it's still a work in progress now, I think, in the industry.
And this, you probably touched upon this, but could this also be something that, you know, you offer, you know, that a hospital offers to someone as they're getting discharged for, you know, for 1 month or something like that?
Yeah, it originally was thought of as a discharge product. You know, it'd just be offered by providers. But back in the old fee-for-service days, you know, which is we're migrating in healthcare away from fee-for-service to, you know, value-based, where I keep you healthy. Back in the old days, they didn't worry so much about people coming back, perhaps, you know, from a financial standpoint, because that's candidly more things to do. So it was, you know, it's horrible to say, but it's what we were told, you know, on the side, by people. But now, I think it's ideal for that. You know, it just as one more thing. It's not designed to replace the brochure, because some people just need the brochure, right, that they hand out. This is something that I can just kind of pull up on my computer or on my device when I need it. If you want incremental engagement, you probably need to do incremental methods to get into people's lives. So.
Well, at this point, which are the videos that are most used? Do you track that?
Yeah, every action is tracked by, you know, by the system can figure out what the most popular areas are. You'd see it track like, you know, it tracks based on how applicable that lesson is to more people. You know, so some people like, you know, disposing of medical waste is going to be lower used because few people have it, right? Whereas things like fall prevention, you know, care after surgery, observing general health, that's a great lesson. Just how to pay attention, you know, on a day-to-day basis, and how to ask the right questions that can uncover those little small fires before they become big fires, and all of a sudden some chronic condition is leveled up into a much worse place. Those are the most popular lessons people go to, the ones that are most broadly useful.
How many users do you have right now?
Well, like I said, we're in the middle of soft launch, so it counts in the hundreds, not thousands and tens of thousands. So, you know, yeah. So
well, how long
like
in your soft launch? How long
We
are you
started
into your
over the
soft
holidays.
launch?
Well, we started over the holidays trying to test pricing and messaging because you get kind of describe this lots of different ways to different audiences. So we were in the middle of that, and then looking for a spring launch on B2B and B2C, and then COVID arose. And so that just basically upset the entire model. And we're like, well, we know for a fact this can help people's lives right now. And let's set financial immediate aside and let's just make this available. So we've kind of paused that obviously for the next 100 days, which we announced last week. Had a really good segment on Fox 2 News, which you can probably see online, with a good interview with one of our personalities who was taken by.
No, I would say a couple hundred users in 4 months is not too shabby, and hopefully the trajectory is going upward. So I've seen people that are like, we've been around for 6 months and we have 10 users. So
right, exactly. Well, like I said, our marketing is it's been primarily the B2B has just begun, so we really haven't had time for that sales cycle to close with the first round of any sales yet. There's some very large ones and some really good discussions going on right now, but that takes a while. And then B2C is all just based on, small efforts on Facebook, Instagram, and whatnot, and some of these influencers, which we need to expand, but to do that, we need some more funding.
So I would definitely hit up like the national, not this year's sort of gone, but the AMA national meetings, the big one in McCormick Place in Chicago, that ginormous meeting. That's 20,000 physicians that, you can hit at the same time. Those are the big channels that people advertise, and, you can probably find your way through that and get some good leads.
I'd be interested, like, what you all feel would be, because obviously people can say, oh, well, people can just go to WebMD if they need that, right? And the AARP, which we love the AARP, and they've actually really upped their game content-wise, it seems, in the past year. Their stuff is more either emotional or surface. They don't really as much. So this is a wonderful complement to that. It's not a replacement for it. But I think it's a challenge for us when we're describing it distinctly, as to what it specifically is, versus these other kind of broadly things which are out there, but nowhere near to the extent. We did a lot of search online prior to this to look for what people could buy, like DVDs, Amazon, all that stuff. And it's amazing how sparse the market is, which candidly was shocking to me as a marketer. But it was like, wow.
Well, like I said, for me, just from my cursory thinking about this, with your connections at Siteman, I would try to get into clinics, like individual clinics, because once you get in on one, that may be a network of 20 physicians, and then basically you have an excellent model, a test case, and then you can easily sell to others because you're saying, well, we work with this practice, and it can be also just, low-hanging fruit would be very specific practice, like you said, oncology. It could be just all oncology, because then you could focus on that market, get their trust, and then move on to other markets after that. But you basically need a win, and like a nice hanging unit is a practice, so that you have 20 to 30 physicians that you can bounce this off of, and then that's a pretty big momentum builder for your next big clients. Mm-hmm. And then you move up to like healthcare management. My brother he was chief medical officer at Evolent Healthcare. I think you'd have to prove yourself a little before you moved into that range, but that's something that they're looking at, because, again, anything that facilitates the transfer of information, that's a win for all.
Thank you, Chris. Okay.
So I guess the question we always try to work with it, always try to ask is, you kind of touched upon it, but, what can the community do for you? What are you, why are you here? What are you looking for?
All right, exactly. Well, again, we are looking for existing entities that have access to family caregiver ears and eyes, basically. So we're identifying who can we go to that already has a conduit to them, because we're not going to have giant marketing things to do national advertising and stuff like that. That's one. Investment to help build toward that, obviously. And then any types of community entities that want to basically serve their populations and might be involved in either directly trying to expedite the message to their population, like we've talked about, going to large churches and saying, hey, you know, you have populations that very much are in the zone of the need. You know, offer this to your congregation, even as a fundraiser, post summer, of course, along those lines. And then, of course, any donors and sponsors who want to basically pay for some deeply discounted subscriptions after the summer to offer this to populations, because this platform can actually be customized in different versions. So you could actually create like a donor-specific version, you know, brought to you by this institute or whatever, to hand out. You know, we're not trying to make CaringBoost this, you know, this job as many of those 44.
Could you, would it be possible for you to go to churches and say, you know, for $1,000 a month, all your parishioners could have access to it, or something along those lines, or, you know, up to 500 people could have access to it, or something like that? Because I think you're exactly right. I think churches would be a really good way, you know, really good way to, you know, to get out, you know, to increase your numbers very quickly.
Mm-hmm. Put a mention with us in a link, and we'll have a deep discounted price, and we'll share some revenue with you for your charity. But just a flat fee to cover your full congregation, that's even smoother. You know? Yeah. So love that.
Something to think about. Yeah, it's nice that this is kind of, you can slice it, you know, slice and dice it any way you want to. It's from a selling standpoint.
Oh yeah.
Yeah, I just messaged you about you should apply for an Arch grants. Why not? You're St. Louis.
Sure.
Yeah,
oh,
go
yeah.
for it.
Yeah, 100%.
Love those guys.
They'll open up in May, mid-May.
Okay.
All right. Well, that's about it, Jeff. Thank you very much. Great presentation. I mean, really, you see a lot, and this was really, it touched upon a lot of things very well, you know, very concisely. It's, you know, it's really, it's clear you've been working on this for a while. And make sure you put down your contact information in the chat box, you know, an email or a phone number or anything like that for people to contact you, to reach out to you. I have a couple thoughts that I'll try to get to you, later. But yeah, that's about it. So anybody else? Anyone else? All right. Well, thank you very much. And we will see cups via Zoom. Thank you everybody for attending, and we hope everybody hope you all have a great week. I'm not sure who PJ, do we know who our presenter is next week?
Yeah, it looks like we have Hive scheduled.
Hive, okay.
HIV. Hive is a social media platform that aims to address common problems such as spread of misinformation, invasive advertising, and misuse of personal data.
There you go.
All right.
Okay. Well, thank you very much.
Yeah.
Take care, everybody.
Bye.
Thank you.